everyone for joining the LCaS meeting, our first meeting of September, and welcome all to joining us. It's been an interesting summer where some of us had hoped to have got time off, but it's been hot, so at least we got that, if anything. And then we're now, it seems that the season has changed very rapidly, so we've probably got rain, and if it's a bit darker, and probably people pulling out those coats already. So yeah, but thank you for joining us. Today we're going to be joined by Selena from Skills for Care. We've also got some information on how to sign up to access the WF funding. So we've got two speakers in regards to that as well, David Vincent and Rogelio Alcina. And last but not least, really, we've got John Buttle, a training provider who actually, there you have it there, who actually uses the WF funding to facilitate his training. So he will tell you how it's worked, the benefits of it, and the merriments of people coming through the door and upskilling themselves. So I'm gonna shortly start now with Selena. I'm gonna make you the co-host in a minute. 1 second, Selena. If you bear with me, I multitask and let others in at the same time.
That's okay, because I just want to say, not forgetting my illustrious colleague Laura Anthony, who is sharing the presentation with me today.
Okay, do you know what? I would have expected Laura. Do you know what? I've got somebody on there. Laura's probably somewhere. So I apologize if I haven't mentioned you, Laura. You're there. So let me try. I'm going to make you co-host. Okay.
Are you going to share your slides, Laura?
So let me try and get Laura in as well.
Mine, and then
Laura, you were very quiet there, so I'm going to make you co-host as well. So there you go, Laura.
Lovely, thank you. Before we start on the WDF, because I don't think we're going to have time to do a usual Skills for Care update, I just wanted to do a couple of little reminders, please. If you're not on the WhatsApp registered managers group, do please get in touch with myself or Laura, because we do post lots of updates on there as soon as we get any news. I know Peter very much does, and so does Dudley, but as soon as there's anything from our side, or any news on any funding or any opportunities or events or anything like that we're doing, we do post it on that first of all. So I noticed the numbers aren't as high as they could be on our WhatsApp group. So if you're not on there, can you drop us a line, and you'll have our details at the end of the presentation, to just give us your area that you work in and your mobile number, so that we can add you to the WhatsApp group, because you're missing out if you're not on there. And the other thing, just for the benefit of Northwest London managers, we're about to start working on a wellbeing survey for Northwest London, which may stretch to other boroughs. We'll have to see first. And part of the purpose of doing that survey is in order to facilitate some of the funding that we're still hoping is coming from the government towards the end of the year for the sector. And part of that is going to be around wellbeing, training and development, and so on and so on. So we really want to try and influence how that money comes out and how it's spent and dished out to the sector. So look out for that. But that's all I wanted to say from our side. I'll hand over to Laura.
Thanks, Selena. So maybe what I'll do is talk a bit about what WDF is and what can be funded. Then I'll hand over to David, who can talk a bit about the process of joining a partnership. Actually training, if that's okay, and then go to John, and then Selena talk about Ask WDS towards the end. Is that okay with everybody? Lovely. So hopefully you can all hear me okay. I just wanted to start by talking briefly about why it's important to invest in your staff. So we know from our research at Skills for Care that offering learning and development opportunities to your members of staff can help you retain them. We can see from our statistics that care workers who receive regular training, care workers who have the chance to complete qualifications, are less likely to leave their roles than those that don't get the chance for this development. We're also seeing a really strong link between high levels of staff completing training and higher CQC ratings. So if you want to achieve a good rating, an outstanding rating, that staff development is just so important. So just a couple of reasons. Coming on to WDF, some of you may have claimed this already, some of you may not have heard of it, but it's funding that Skills for Care has had for about 20 years now under different names, from the Department of Health and Social Care to distribute to adult social care employers to train their staff. And we fund a wide range of qualifications and learning programs and digital learning modules as well. I'll talk in a moment about what's funded. So all employers in England have access to the funds, and you can claim via a local partnership, a national partnership, or directly from Skills for Care. And David Vincent is here today from the South West London Partnership, and he'll be able to let you know how you can join. And the purpose of the funding is very much to support registered managers, other managers, frontline care workers with their continuing professional development. So the new funding round we're hoping should be launching fairly shortly. And once it has launched, you can claim funding towards the cost of any qualifications, learning programs and digital learning modules that are on the eligible list that have been completed between 1st of January this year through to the end of, it could be March next year. We're hoping it gets extended to May, but say kind of mid 2023. And as well as claiming towards the cost of the qualification or learning programme, you can also claim for associated costs. So that can be things like employee salaries while they're completing the training. You can claim for coaching and mentoring costs. If you need to hire a room for your staff development, you can claim back for that as well. And you can usually claim a maximum of £2,000 per learner per funding year. And I assume that's going to be the same again for this year. So what you can claim for, so there's lots of level 2 and level 3 awards and certificates in a range of different topics, which you can see listed on the slide here. So mental health, dementia, autism, activity provision, social prescribing. Hopefully you'll find something that meets the needs of your organisation and your staff. You can also claim for the level 2 and level 3 diplomas in care. And these are probably the most popular. These are the ones that people claim the most funding for. If you're putting your staff through apprenticeships, you can claim for these as well. So levels 2 to 5. So level 2, level 3, the frontline worker apprenticeships, up to level 4 and level 5, which are all advanced practitioner, leadership and management level apprenticeships. Some other certificates and diplomas you can do in leadership and management. There's a level 4 diploma in adult care, a level 4 certificate in principles of leadership and management in adult care, and also the level 5 diploma in leadership and management for adult care, which is a qualification we say that all registered managers should hold. And you can claim back about £1,500 for that. But we'll give you the link to the full list of qualifications and learning programmes, and you can see on there exactly how much funding can be claimed for each. So learning programmes, and these are delivered by Skills for Care endorsed providers under licence, and there's a whole range you can choose from. So just to pick a few examples, there's an end-of-life care programme for frontline workers. There's a programme called Well-Led for registered managers. And there's also some smaller learning programmes also for registered managers. So one on understanding performance management, there's one on workplace culture, one on self-management skills. And again, if you're interested in any of these, just let us know and we can send you the link to where you can find out a little bit more about what they cover and how much funding you can claim back. And a few other things you can claim for. We've got a digital module called Learning from Events. And this is designed to support managers in social care to carry out learning reviews where perhaps an incident has happened in your service. So bringing people together to look at what happens and how a situation can be addressed. If you have members of staff who are assessing the care certificates, there's also a digital module they can complete around that. We have a whole range of digital learning modules for managers on a range of different topics. You can claim funding for mental health first aid courses. And also recently, Skills for Care has produced some digital learning modules around CQC inspections. There's one on preparing for inspection, and there's also one for managers who have services with a rating requires improvement or inadequate. And that just gives some tips on how you can actually make changes to bring your rating up. And in many cases, the funding covers the full cost of accessing the module and also your time spent completing it. So really worth looking into. And I think that's all from me. So it might be a good idea now to hand over to David, who can talk in a bit more detail about joining a partnership and how you can actually claim the money.
Thank you, Laura. Yes, thanks for that very detailed presentation about what the fund is and the different types of qualifications you can claim for. So yes, she's right. That from my experience of running the partnership in the last 12 or 13 years, historically lots of people have used it to claim back for level 2, level 3, level 5 diplomas. But more and more, these learning programs that have been running for the last few years have proved very popular. And it's just a great way of getting some effectively free training for your staff. And the digital modules that she mentioned last were, again, becoming more and more popular the last couple of years. So I'd urge you to have a go at that. You know, it takes a few hours to go through all the modules, but then you can claim back sort of 500 odd pounds per candidate that does it. So it's really worth doing. It helps with your training budget. But excuse me, in terms of how you claim, so you have to join, as Laura said, either a local partnership, which I run the South West London partnership, but the way things have gone the last few years, I'm not so limited to the South West London geographical area now. So if you're not in South West London and you're still looking to join a partnership, please get in touch with me and I'll discuss the options. Or there are national partnerships as well. It's whatever you prefer. But I'm going to have a pot of money to spend. I'm looking to expand my reach and take on new partners who can come. And then I can provide you with advice on how to access the funding. I can signpost you to some training providers and just help you with the process. Really, all I need from you is need for your candidates to do the training and provide some evidence of that. So that's normally a certificate of completion. As it said on Laura's slides, we need their registration numbers and importantly their ULN number, unique learner number, which your training provider can provide to you. And then the biggest thing is that you have to be registered on the Skills for Care, Adult Social Care, WDS website, where you need to register all your workforce. And there's lots of information you need to put in, or you can put in. It's a very useful resource to help keep on track of your employees and then their training, their existing training and their training requirements. That one needs to be updated. That can take a little bit of time, but it's really worth doing. And once that's done, then you're eligible to claim the funding. It's quite a simple process. As I say, all you need to do is really send me all the stuff. I check it, make sure everything's in order, send it off to Skills for Care. I get the money back and I send the money to you. So get involved. There's literally hundreds of thousands of pounds to be spent this year. I don't have an exact figure yet. We're still waiting for the contracts, but I've certainly asked for a lot of money, and I'm hoping they're going to send it to me so we can I can help out all you guys. So yeah, please get in touch. I'm sure Dudley's going to circulate my contact details.
Indeed, and as we have more meetings, and actually probably hopefully before the money comes, we'll have a queue of people and we might invite you to a live event with a clip.
Yeah, absolutely, that'd be great.
Yeah. Before we sort of turn over to John, which is I'm sure John's itching to tell us about the training, there are a few questions. If anyone's got any questions they want to ask either David or Selena or Laura in regards to the actual WDF and processes. I know I had some questions that people had asked me prior that I'd ask. I know some people can be shy, but if you don't want to come on camera, you can put something in the box, and we can ask as well. So I'll leave the floor open to anyone who wants to ask any questions. You can raise your hand or indicate. And then if not, I've got about 3 questions that I want to ask as well. And this is the time and hint when someone says there's free money available that, you know, people in social care should be piping up, which is always surprises me why they don't ask any questions. But so I'll start with some of the questions that I want to ask is the training that's available, the money that you can claim back for, will it be possible for group training as well rather than individual training?
Yes, that is entirely possible. Because often care companies may have just 1 or 2 members of staff that they're looking to train. If they go to a training provider, they might not want to put on a course for just 1 or 2. So we can try and facilitate that and get members of staff from different organisations. Although I must say that with the COVID and everyone's on lockdown, everyone's happening by Zoom. Lots of the training can happen by Zoom now, which I'm sure John will come on to, and that has actually proved an opportunity for John and other training providers, because you can just sign up 1 or 2 people.
Yeah.
Okay. Another question that I'd asked is, how long does it take, or the process take, to actually sign up to actually get on the WF to get the funding? Because I know a lot of people
to join the partnership. Yeah. All I need is for you to send me a membership form, which is just a simple form to fill out with your CQC registration number, your ASC WDS number, people call it Ask WDS number, and that, you know, name and address. Send that back to me. But the time that takes is to make sure that Ask account is actually updated properly, because in order to become eligible for funding, you have to have updated all of your employees in full at least once a year. I mean, the website is designed for you to use it as a live document almost. So you know, when you take new people on, you register them. When people leave, you take them off. But at the very least, you need to do it once a year and update everything. So depending on the number of staff you've got, that might take you an hour or 2. But yeah, minimal really.
I guess the advice there is when changes happen, try and do them in real time rather than
absolutely, yeah.
months with it doing it there. Okay, we've got a question in the group from, I believe, Nikki. She says we have over 150 homes. The admin task is huge to update the team details, and turnover is challenging. Any advice for big providers to manage this process, as you've just mentioned? So I'm not sure what tips you would suggest.
I know Laura's put an answer about looking into bulk upload, where you've added people into your own HR system or your own spreadsheets. But the other thing I was going to say is I've come from local authority where we would have had to have put on at least 250 members of staff, more than that, from adult social care. And it is literally just a case of staying on top of it all the time. As Dudley said, if someone leaves, change it. If someone comes, change it. And what we used to have is 2 or 3 people that were trained to do it. So advice that I've been giving to other providers is if you can take on an apprentice, or you can take on a student to sit and do it for you, because it's actually very easy to do. And if there's time, I was going to quickly demo how you do it, but it's literally, we've changed the way you add people in now. We've updated our system, and it's you're just literally filling in a form, just as if you were filling in a form on a .gov website, or, you know, putting in your car tax details or something like that. It's very, very straightforward, and it's quite uncomplicated. So my advice would be take on a body that, you know, that would happily sort of support your organisation, just to keep on updating it every time someone starts and joins or does a training or something like that. Because we do appreciate there are large organisations out there with lots of franchises, and it's difficult to stay on top of. Either that or let it be your HR department that take care of that. Or are you the HR department, Nikki?
I would love our HR department to take it on, I really would, but I don't think that's going to happen.
Yeah, because I mean, the data that you put in, although somebody has to have sight of the details of the staff members, it is anonymous once it hits Skills for Care. So we have got no idea who's who and what's what. We're just taking literally the data, and you know, it's aggregated into stats. So we have no idea. So, you know, if you can get somebody that can just sit and plug that in for you, that would be my best advice, really.
I think also people forget to mention, once you actually have all this information in one place, it really helps for you as an organization to actually have a look at what your staff are doing, their development, and it's going through it. It's really helpful as a tool, as part of your sort of staff development tool, which you can demonstrate with CQC, and CQC, I think, would love to see information like this. So even though it may be a laborious task in the beginning, once you've got it done, you've got it done. Like most things, people always say about the same thing about care plans and records, but once you've done it, it's a case of just updating it, I believe.
The other thing, just very quickly, sorry, Dudley, before it leaves my brain fog, is that we will help you as well. So if anybody on the call or anybody wants to get started and is a little bit like, oh God, another admin task, another return, we'll sit with you for 15 minutes, 20 minutes, you know, on Zoom or Teams or whatever, and just talk you through it. It's so easy to do. I've done it with a few providers lately, just literally had a 15-minute chat on the phone, shown them a screenshot of how you do it and got them up and running.
I think Nikki might take you up on that one. I think for those 150 different things. So, this one question, another question I had was, how was the money given? Is it given before the training, at the end, during the period? How does that work? I think would be a question I'm sure David might want to.
Yeah, I can answer that. No, you have to complete the training. So you need, in most cases, you'll be paying for the training yourselves up front, because the training provider is going to need the money. Some training providers may defer some of the payment until afterwards, because they know, you know, so they know the money's going to be claimed. But typically, once I get the information I need, i.e. the proof of completion certificate and all the reference numbers, etc., I send it off. Generally, you can get the money within 3 weeks from Skills for Care, so it's not a very long time. And then the idea is you can then go and pay your training provider if you owe them any money. But no, really, you have to pay for it up front and then claim the money back.
No, thanks. I think that was one of the last questions, which is important when it comes to funding, so people understand, because that they may have to pay the money themselves first, but you will be able to claim it back to get you.
I've just thought of something else that I should probably mention, because it often comes up with new people coming in. They think, great, there's a big list of qualifications that you can get involved with training, but unfortunately it doesn't cover your basic induction and you know, getting new members on board. Because often I get people sending me their induction care certificate training and stuff like that and say, can I claim for this? And unfortunately you can't. No, it's only the stuff that's on the RQF regulated qualification framework and the other qualifications that we've discussed today.
So those who are not sure, please do go into it. I think Laura may have put it out there earlier in the chat, to have a look at what you can claim for, rather than putting all sorts of claims for potentially dog training or anything like that that you might have in mind. So yeah, that makes sense. Thank you very much. I'm gonna now add in briefly John Buttle, who has been who is a trainer and has been dishing out all this sort of training for a while. I'm going to bring in John. John, I'm not sure if you want me to get you in to share a screen or.
It would be helpful. I mean, I haven't got many slides, so please don't worry.
Okay, no problem. I'm going to add you in 2 seconds and join you as a co-host somewhere when I find you on my screen. You should be there somewhere. Okay, bear with me.
David, there was a question about what proof people need to show when the member of staff has completed something from Prem Kumar.
I'll go through that, don't worry.
Okay, I've made you a co-host now, John. So when you set yourself set up.
Okay. Here we go. Can everyone see that okay? Lovely. I'm not going to put it on the full slideshow because it's just easier to maneuver, but just to introduce, my name's John Buttle. We're Social Works Limited, and we've been working but almost exclusively with WDF funding for about 14 years now, if not a little bit longer. We're an endorsed provider with Skills for Care, which means that, you know, we have to go through a quality assurance process with them. And it also means that there are certain courses that Skills for Care offer that we and only other endorsed providers can offer. And a lot of those are the management courses. I'm briefly just going to run through the first few slides because they're just a reminder of how to get involved. So just as a reminder of what the WDF is, it's Department of Health money. It's administered by Skills for Care. It only funds RQF qualifications and courses licensed and endorsed by Skills for Care. And I know you've got a big long list of qualifications, but it's worth remembering that not, and I hope Skills for Care won't mind me saying this, but not all of them work very well with the funding limits and the way that they get delivered. So don't automatically assume that every course that you see that's funded necessarily will work with every learning provider in practical terms, because it depends a bit. From a learning provider's point of view, you normally only register with 2 or 3 awarding bodies, but you know, people will come to you and say, can you do such and such a course? But if it's not with an awarding body that you're registered with, then unfortunately you can't. So there's a little bit of that goes on. It's totally separate from skills funding agency money, which you might be used to in terms of apprenticeships. So with Skills for Care, it's not money that follows the learner, it's money that goes to the employer, which is a big difference in practical terms, which I'll come on to a bit later. The good thing about WDF funding, apart from the fact it's there, is that it doesn't have a lot of the difficulties and the hoops that you have to go through with skills funding agency money. So there's no restriction on nationality or employment criteria. It doesn't matter whether your staff are full-time, part-time. It doesn't actually matter if they're volunteers. You can use the funding to train volunteers as well. So it does make a lot of things like that a lot simpler. There's no functional skills tests if you're doing a diploma, etc., etc. But it is, and I must stress this from a point of view, is it's retrospective. So the person has to complete the course before you can put the claim in. How you become eligible, basically, is what everyone else has been talking about, which is you go through signing up with the Adult Social Care Workforce Data Set, which, I mean, I hope you don't mind me saying it's not fun, but once it's done, it's done. And once you've got there for the first time and you've got all of your staff in, it's actually a lot easier then just to kind of go through and change as and when you need to make changes. As has been said before as well, it's worth remembering that, you know, nobody at Skills for Care can identify your staff through this. So if there is a worry there in terms of data protection, that's not really an issue. Basically, you put the information in, centrally an algorithm will give an ID to a learner that Skills for Care sees, but they won't be able to identify that person's name or anything else from that. So step 2, join a WDF partnership, or some people claim direct as well. Choose a course, train, claim, and then claims and invoicing, really. So I'll go through each one briefly. I'm not going to take too much time on getting set up with the ASC. There is a minimum amount of information that you have to put in. You can add an awful lot more information if you want to use it as your own kind of HR tool, but you don't necessarily have to do that. And once you've got everything in, as I said, it's a lot easier just to go in and adjust as staff move around. Again, you know, nobody at Skills for Care can see your staff's data. And this is quite important because I know a lot of people get very, very twitchy about, and understandably so, about who can see details. So it's worth remembering it's nice and kind of secure like that. After you've done that, or at the same time as you're doing that, join an employer partnership. And as David is saying, that is a really easy process. It's a one-sheet form. You just have to put in your ASC number, basic information, contact information, and just kind of sign at the end. And it's a really simple thing to do. Choosing a training provider, well, you know, lots and lots of training providers are available. I'm not going to pretend that there aren't other good ones around, because there are lots of great ones around. There's lots of not so great ones around as well. So, you know, you don't have to choose us, but please do make sure that when you're picking a provider, check with a couple of customers, check with a partnership to see what kind of track record they've got. For us, we make things relatively simple. To get a learner enrolled, if you're in a partnership, it's simply we need their email, their telephone number and their name and what course they're going on. We will then send out links to all of our training, which is all, for WDF terms, virtual anyway now. We used to be, like a lot of other training providers, very traditional in our approach with classrooms and stuff, and then COVID came along. And actually, we're finding that people are preferring the virtual layout. And I'll come on to why when I look at some of the courses we do. But it does mean as long as people have got a computer or a laptop, then they can join from wherever they are. For management training, we found this really, really helpful, because getting a group of managers to turn up in the same place at the same time is really, really difficult. Whereas getting a group of managers from lots of different organizations just joining a live session like we're doing now is actually nice and simple. So basically you choose a course, we register you on, let us know who you want to get updates in terms of, you know, whether people attended and stuff. Check that people understand the commitment they're making in terms of the time involved, whether there's homework involved, and just check that they've got access so that they can join the training. In terms of the courses we do, I know that the care certificate isn't funded. However, we have been a little bit cunning on that in the way that we do things. And we've trained, well over 1,000 staff since March 2020 using the virtual platform. And what we do is there's a level 2 medication qualification for people working in social care, which in its own right is a brilliant qualification. It gives you way more detail on medication and the kind of work around that than you would get from your normal half-day medication training. And it is an accredited course, and it comes with funding from Skills for Care. So what we do is we use that funding to subsidize care certificate training as well. So basically over a 4-day period, we do the level 2 medication and we do everything in the care certificate knowledge except basic life support. There's homework as well, and there's guided learning. So it's not that people are just kind of left hanging, but we've been doing this for ever since COVID started now. As people were asking, what if you only have 1 or 2 learners? Well, it makes no difference to us. We will, every Thursday, we will have a new cohort starting, and we have done every single week apart from Christmas for the last 3 years. And we will get maybe 1 provider sending 1 learner, we'll get another provider sending 2 or 3, etc., etc., etc. And we have a live Zoom session for that, which runs from 9:30 till around about 12:30 each day. And then homework with extra support via telephone and email with the tutor after that. So whilst again, as I was saying, care certificate isn't funded. This 4-day induction for new staff is. And we've got probably about 30 providers who will regularly send us a person here, a person there, and some providers who send us 5 or 6 people every week. In terms of management training, as an endorsed provider, it does mean that we can offer all of the Skills for Care endorsed courses, which are, I have to say, are actually really, really good. We get fantastic feedback from them. The management multi-session programs we do Well Led, which is for established managers, and we run that over 4 consecutive weeks. So you have to be available for a Zoom session in 4 consecutive weeks. If you miss one, we can plug you into the day that you missed in the next group that we do, or sometimes you can have a one-to-one with the tutor and catch up that way. With Lead to Succeed, which is for new and aspiring managers, same principle, but that's over 5 consecutive weeks. We also do all the single session management CPD modules, and again, they're just run over a half day with kind of additional support and work requirements. And they are really, really good for filling in some of the gaps in management that you've got with your staff. We also offer various specialist knowledge groups. There's a Skills for Care endorsed end-of-life care program, which we run. I know that might well be running out towards the end of the year, but we're hoping that that will get replaced with an updated version. But it's a really good course. It's run by one of our nursing trainers who has got, well, more experience in palliative care than anyone probably ought to have, really. And that goes down very well. In terms of the autistic spectrum conditions, the level 2 certificate is an extremely good course, but it is quite in-depth, and that runs over 3 consecutive weekly sessions, about 2 hour, 3 hour Zoom session each week. And then, if I'm honest, a fair chunk of homework to do between one session and the next. But it is a very, very good course for anyone who's working with people who are on the autistic spectrum and want to really get to know more about it. And we do the same with the level 2 award in awareness of dementia, which has 4-hour live Zoom session and then supported homework that follows. I haven't put a slide up here, but we also offer all of the diplomas just through the Skills for Care funding. So they're not on the apprenticeship route, but we do charge an employer contribution to go with those, because obviously, you know, when you're having to complete a course in order to claim, it means that as a provider, we can't really wait, you know, kind of 8 months to 12 months, depending, before we can claim a penny back for the training that we're doing. So if you do want to talk to us about those, please let us know. It does mean that you can send staff on a diploma course without them having to worry about doing functional skills. It can be much, much quicker. Level 2 learner, if they're keen, we can normally get through in around 6 to 8 months. Level 3 learner, we can normally get through in around 8 to 12 months. And most of the workshop sessions will be virtual, and then obviously we'll have holistic observations, which will have to be done face to face. But it is a good and quick and fairly straightforward way of getting people through a diploma. In terms of claims and invoicing, for the short courses, we invoice at the same time as we put in the claim. So say, for example, you've done a management course. At the end of that 5 weeks, you'll get your certificate. We will send in that and the evidence to David or whichever partnership you're with. And at the same time, we send you an invoice. We have 40-day terms on that invoice, which means all things being equal, you will normally have the money back from Skills for Care via the partnership before you need to pay us. But please don't forget that, you know, we're a small business like everyone else. So if there's a delay there, or you've forgotten to do your ASC and you're a bit behind with that, by all means, carry on and do that, but please do pay us, because we rely on this kind of thing just like everyone else does. Is there any questions with any of that? I know it was a bit of a whistle-stop tour. This is why you tell me that I was muted all the time.
No, listen, that's been really helpful. I think it gives people more understanding from the providers who actually taking on the training. I also like what you've mentioned at the end as well, in regards to 40 days as well. I guess the point I would ask is, a lot of providers will ask is, obviously a lot of their training, CQC come in to have a look at their training records as well. So how does that sit with CQC, and do you assist providers in getting their sort of training records together as well, or can you help with that?
Well, we don't normally do an awful lot of that, but because of the way we do it, each learner has an electronic workbook which will be completed, which will be signed off, so that can become part of a body of evidence when CQC come in. And that's really helpful. You've got the certificate, and the RQF medication is from Highfield awarding body. It's nationally recognized, the same for all of our RQFs. They're slightly two different awarding bodies we mainly work with. So yes, there's a good kind of track line through all of that. And David, I mean, we've been working with you for, well, God, probably more than 10 years now, haven't we? But
yeah, that's right.
And I think it's fair to say this has worked pretty well over all of that time. I mean, at the moment it's a bit tricky because we're still waiting for the funding to come through. We've been continuing training because we knew that it was coming ahead, but it's a bit of a ring and a prayer, and it'd be very nice when the funding does come through. But yeah, generally, David, I think it's fair to say, your claims go through pretty quickly, don't they?
Yeah, no problem. John always provides me with all the information I need, which is very helpful. Sometimes you have to chase training providers, but yeah, they've got a good system going. They know exactly what needs to be provided. Always get great feedback from John's course, I must say. So yeah, get involved.
Okay, well, thanks. I think we would love to sort of, I mean, there are endorsed providers, and Skills for Care do endorse providers, and John Buttle's company is one of them. So it's great to see. And we haven't got long left, so I know I've got Selena who's got a question she wants to, or she wants to raise a point.
It's just very, very quickly. Nikki very cleverly raised a barrier to what could prevent people signing up to the data set and claiming this funding. It's very, very good intelligence for us if you can let us know what the barriers may be, or why you haven't set up a data set account, because that way we can find the resources, or we can find a way to help you, because at the moment we don't have the full picture of what's happening in nationally with providers in terms of the workforce and who's who and who's where and so on. And we need that to influence the government in terms of funding, future funding, and how we support you as providers. So if there are barriers, please do feel free to let myself and Laura know, or David or Dudley, John, because it is that way we can find a way to shape our help best for you.
And I think to add in, I mean, John's mentioned people don't think they can claim for certain things. Some training providers will give you an insight of what you actually can claim for. So do get in touch with the likes of John Buttle and other people. It'd be very helpful. And thank you everyone for joining us. Just a few bits and pieces before we go. We are going to have an actual live event for those who are local to South London on the 21st of September. I think it's our first live session before since I think March, is it 2020? So so please do, for those who want to attend. We were meant to be actually getting the minister from the DH at the time, but with the governmental changes as well, I think that's been put on hold. So but everyone's going to come and and feel free to ask any questions. We mentioned obviously things such as the WhatsApp group as well. You've got Selena and Laura's number as well to contact. And by all means, when you do get on the WhatsApp group, you can pose a question at any time. It's not just for the meetings or any requests. And even if it's not answered by one of us, it also someone in the group who may have knowledge or experience has helped as well. So thank you everyone for joining. If there are any questions or points, please do get in touch. And I suggest everyone have a great day. I know it's probably raining out there for most of us. So sadly, do have your umbrella and keep dry as best as you can. And thank you everyone for joining.
Thank you.
Everyone, bye.
Great.
Everyone.
Yeah.